You've just spent hours meticulously creating your favorite meal. Everything is finished and plated, and you finally sit down to indulge. The first bite is heaven, and the second bite is just as good. But an instant after having the third bite on your fork, it happens. A sharp piece of food stabs you in the gums, hard. Shooting pain immediately radiates throughout your mouth as the distinct metallic taste of blood seeps in. You spit everything out. Now you're just angry and don't feel like eating anymore. But what if that sharp piece of food hadn't stopped at your gums? What if, instead, it made it into your throat, and by the time it cut you, it was already too far down in your esophagus, and your only remaining option was to keep swallowing? October 2014, 75-year-old Vera Williams was enjoying her meal when she suddenly felt a sharp pain in her throat right after swallowing a bite of toast. No amount of coughing, swallowing, or drinking water would alleviate the concerning amount of pain in her esophagus. So, she made her way to the Glenclwyd Hospital emergency room, but the results of her visit would be far from what she hoped. A routine check was conducted on Vera by a junior doctor who didn't see anything wrong with her. And without any further investigation into why she was complaining of the sore throat, Vera was sent on her way. I couldn't agree more, Bean. But it seems the doctor didn't grasp the severity of Vera's pain, or maybe just straight up didn't believe her after the throat examination showed zero visible signs of anything that could be causing her symptoms. But this would prove to be a huge oversight, because back home, her pain not only continued, but worsened. Vera seemingly waited as long as she could for the issue to resolve itself, but after 2 weeks, she couldn't bear the pain any longer. So a couple weeks later, on October 23rd, she returned to the hospital and was seen by a different doctor. During her examination, she explained that she was having neck pain, but it said that she left out some very crucial information. She allegedly never revealed having spent the prior 2 weeks in immense pain. So, still with not much else to go on other than neck pain and a previous visit to the emergency room, the doctor came to the conclusion that Vera must have some sort of infection, prescribed her antibiotics, and sent her home the next day. But it wasn't just an infection that was plaguing Vera, it was something much more serious. And the day after returning home from the hospital a second time, things took a dramatic turn. Vera began coughing up blood. This, along with the severe pain that hadn't let up in weeks, landed Vera right back in the hospital for a third time. However, the gravity of the situation was heightened due to the blood in her cough, so this time she arrived by ambulance. This also caused the attending doctor to do what neither of the past 2 doctors had thought necessary before: send Vera for a CT scan in an effort to pinpoint exactly what was going on from the inside. And reveal what was going on, it did. Vera had suffered a ruptured esophagus while eating her piece of toast all those weeks ago, and that small tear in her throat had caused a massive amount of blood to flow into her intestines. Well, one would hope that this revelation would put an end to Vera's journey of excruciating pain and the growing list of doctors who didn't believe in the severity of the situation. Now she could finally get the help she needed, right? Well, turns out the treatment for a ruptured esophagus isn't exactly simple. In a study that took place from 1995 to 2008 at a UK hospital, 34 esophageal perforation cases were reviewed. And when it came to the treatment, doctors tried a number of different approaches, including surgery, tailoring the treatment to fit each specific patient. Despite these efforts, there was still a nearly 24% in-hospital mortality rate among those affected. But that's nothing compared to the mortality rate before the use of antibiotics, which was known to be as high as 90%. And esophageal perforations don't only happen after eating something sharp. There are a few ways a tear can occur. A severe blow to the chest or neck, intense vomiting, or an obstruction caused by swallowing something large can also lead to a rupture. Take this example of a 23-year-old woman from the Netherlands who had a serious fall from about 8 meters up, about the height of a third-floor balcony. She was rushed to the hospital, but initially did not appear to have life-threatening injuries. However, she had significant and unusual swelling due to air trapped inside her chest and neck. Puzzled by the source of the air, doctors conducted x-rays and a CT scan, which revealed some broken bones and a possible tear in her esophagus. Opting for a conservative approach, doctors treated her with antibiotics, while she had to feed through a nutrition tube to allow the tear to heal naturally. After weeks of careful treatment and monitoring, her condition improved, and she resumed normal eating and was discharged 3 weeks post-accident. She was lucky to have immediate treatment and a thorough examination since her injury was really not obvious. But unfortunately for Vera, even after the doctors found the cause of her pain, there was one thing standing in the way of her treatment: a previous diagnosis of a severe case of heart disease. The pre-existing condition prompted the doctors to make her decision to forego a surgery that could have, in other circumstances, been life-saving for her. As a result, Vera's pain and bleeding continued, and with no other options available, sadly, passed away a few days later with the cause of death ruled as massive internal bleeding. An inquest to Vera's death led to a serious incident review where Dr. Marian Hughes, a senior emergency medicine consultant, reviewed the attending doctor's actions who had seen her in the weeks leading up to her death. When the second doctor Vera had seen was asked why they only prescribed her antibiotics and didn't perform any scans, they said there wasn't anything to indicate any damage. This was because the tear was so far down Vera's throat that it wouldn't have been visible without special equipment. I don't think I would have done anything different, and I think the conclusions they came to were reasonable, Dr. Hughes said. Despite the rarity of the case and reasonable actions the doctors claim to have taken, Vera isn't alone. The fact remains that it took 3 trips to the hospital, including 1 dismissal and 1 misdiagnosis, for Vera to get a much-needed scan of her throat. But it turns out that medical misdiagnoses as a whole are not all that uncommon. In fact, each year, an estimated 371,000 people in the United States die due to wrong diagnostics. About 75% of these errors happen in cases involving heart problems, infections, or cancer. Conditions like stroke, sepsis, pneumonia, blood clots, and lung cancer are also frequently misdiagnosed. And despite the high numbers and significant impact misdiagnoses have, public health research on diagnostic errors is seriously underfunded. The investigation concluded that the attending doctors had acted appropriately and could not have foreseen the rare medical complication that occurred. Hughes, who had been a doctor for 40 years at the time of the incident, said she had never encountered anything like it throughout her career, adding, quote, "Throughout the country, I believe there are 3 cases per 1 million of population." So, as emphasized in Vera's case, when your body is telling you something is wrong, advocate for yourself and ask for extra testing if needed. Ignoring or downplaying the pain or other signs doesn't give your doctor the whole picture, since you know your body best. If you're captivated by the mysteries of the human body, or just simply keen to learn about unique and unexpected cases like this one, don't forget to subscribe to our channel. You have no idea how much just 1 sub helps us. Hit the bell icon to ensure you never miss out on our upcoming videos, which are packed with stories and insights that might change your perspective on everyday things. Like this one, about the man who died choking on food that wasn't there.